am Dr. Mallikarjun Sakpal, consultant hepatologist at KIMS Hospital, Bengaluru. So today I am going to talk about fatty liver disease. So fatty liver disease means excessive fat accumulation in your liver cells. Normally there is a small amount of fat in your liver, but when it increases more than 5 to 10%, then it is called a fatty liver disease. So there are 2 to 3 types of fatty liver disease. There is a recent change in the terminology, means naming the fatty liver based on the causes or etiology. So one is called metabolic fatty liver disease, that is called MASLD. That means those patients who have underlying metabolic liver disorders like diabetes, hypertension, obesity, and they develop fatty liver, then we call it as a metabolic associated liver disease. There is other type of fatty liver disease in patients who are thin and lean, then fat accumulates because of alcohol intake. Then it is called alcohol associated steatotic liver disease or alcoholic fatty liver. There is a third component where there are both combined, means some patients are taking alcohol along with the underlying metabolic liver disorder, then we call it as a MET-ALD. So what are the common symptoms of fatty liver disease? Majority in patients, the fatty liver disease is silent. That means they are asymptomatic, but few of the patients may have some form of abdominal discomfort or some may have fatigue. And whenever there is advanced liver disease, then based on some, that's what we call as a cirrhosis, then they develop that symptoms called jaundice, ascites or blood vomiting. So these are the usually common symptoms what we encounter in the patient with fatty liver disease. Now how to identify fatty liver disease? So usually we need certain blood tests and screening ultrasounds to find out. So blood tests like LFT, lipid profile, these will help in finding out the fatty liver disease. And if you do the ultrasound, you can detect the fat in the liver cells. Now coming to the treatment. So treatment usually depends upon the what is the cause the fatty liver. As I said, there are 2 to 3 causes for fatty liver. Majority I told it is because of underlying diabetes, hypertension or dyslipidemia or obesity. So we treat all these risk factors and there will be improvement in the fatty liver disease. Like other etiology of fatty liver, I told alcohol. So if somebody is taking alcohol, then they have to stop alcohol, then there will be gradual improvement in the fatty liver. And third, other causes like drugs, sometimes these causes fatty liver. We have to stop those drugs, then there will be improvement in the fatty liver. Some of these patients, there are newer drugs also have come where there is fat has accumulated excessive and there is associated obesity and there is advanced fibrosis and there is newer medication we can use and stop the further progression in the liver disease. Thank you.